Great. Welcome to Oncology Data Advisor. Today we're here at the ASCO annual meeting, and I'm joined by Dr. Leyfman. Thanks so much for coming on today.
Thank you so much for having me. Truly a pleasure to be here.
Would you like to introduce yourself and your platform at Newsweek?
Sure. Thank you so much for the opportunity. So I am a physician and a researcher from Mount Sinai, New York. So during the height of the COVID pandemic, as we're all aware, there was a lot of healthcare misinformation. And because of that, that really is what led to the development of Newsweek, which is a virtual education platform with the main goal of combating global healthcare misinformation and contributing to healthcare education, especially in redeveloping and developing countries globally. And we're very proud of the growth that we've had so far.
Great. So what are some of the types of programming and the content and the topics that you cover?
So initially this began as combating COVID misinformation, but eventually it evolved to something bigger than that because misinformation is rampant even beyond COVID. Mm-hmm. So we feature topics across all of medicine, but at this stage of the game, it's mainly oncology. We feature all topics from, let's say, the latest developments in immunotherapeutics, which has been a highlight of this ASCO meeting, to molecular diagnostics, to the incorporation of lifestyle medicine in oncology and cancer treatment and therapeutics, to importance of mentorship for trainees, and beyond and beyond and beyond. There's no topic that's off limits. It's just whatever would pique the interest of our audience, which we're very happy to see is continually growing with each and every single episode.
Great, yeah, it's a very successful platform. You really cover a broad range of subject matter. What are some of the factors that have contributed to your large viewership?
So I can't take all the credit, and I refuse to take all the credit. I like to say there's no me in Newsweek, it's we. And the largest we is the team that we have, our passionate trainees and physicians and researchers who selflessly give their time to make this platform, to build it up and grow it and make it really what it is today. But equally important to that is the great speakers that we've been able to have. Global leaders in medicine like Dr. Julie Graylau, who's the Chief Medical Officer of ASCO, who have graciously given their time and energy to educate our viewers on various topics in medicine. And we're very fortunate to say that we're booked solid until the end of this year, and we're already starting to book for next year.
It's so exciting.
Thank you.
So what are some of the additional directions you're looking forward to taking next year and the coming years?
So something we've noticed during the pandemic is there was a decrease in the number of conferences. And given that when you're an early career researcher, an early career physician who's really trying to build a name for themselves, it's very difficult to have a platform or have someone to really showcase the work that you're doing. On top of that, even if you're in a large institution, it's easy to be lost in the fold or just be a number in the large contingency of everyone that is there. Mm-hmm. So we strive to highlight the work of the next rising stars and the present stars in the field. So we'll be launching a series called Research Spotlight, which we hope to do that, which will be a two-part series. The first part will be looking at the person behind the white coat, so to speak, looking into their journey, why they picked medicine, why they picked their particular field. And then the other half will be speaking about their research, their passions, and really what innovative trajectories they are doing to move the field forward into the next frontier.
Great. So speaking of this next frontier, what is the impact that you think that global health education can have?
So we've already seen that with the current success of Newsweek. We're very honored to have a poster here at this year's ASCO meeting. But we actually have two posters just announced last week at the ASCO Breakthroughs in Japan. Nice. Later on this year. Our impact and our mission is contributing to global education. Mm-hmm. In 1 year, we've been able to hit over 60 countries, 20 of which are of lower socioeconomic status. We're approaching the 1.5 year mark, and I'm happy to say that we've covered most of the countries across the world. We have some form of a footprint. Wow. And our goal is to continue to grow. We have a partnership with ViewMedi, which is essentially the YouTube for healthcare providers, where a large subscription of physicians on that platform is community care practitioners. Mm-hmm. So our goal is to use our social media network, social media platform, and our partners to help spread the message of the latest developments in the field to contribute to global medical education. So everyone is up to date on the most cutting edge information, but also verified information from the sources, from people who really are setting the guidelines or on the guideline committees to transform patient care.
Fantastic. Has social media been the main avenue through which you've reached so many countries?
It has. We are happy to say that we're on most social media platforms and continuing to grow and expand our global reach. And we're looking forward to growing it even more as our team grows and we are able to host a greater number of speakers and diversified speakers as well. Our goal is to showcase the brilliance that is out there, irrespective of where they are in the world.
Absolutely. One final question I'll ask you is, since the theme of ASCO this year is partnering with patients, how do you strive to do this at Med Newsweek?
So a part of the mission of Med Newsweek is to pick topics that are geared towards patients. We have a large patient audience of patients and patient advocates. That's what allows us to stream to all the platforms and really reach patients as well. We're trying to form partnerships with nonprofit organizations as well, and use that as an outlet to reach patients, provide them and connect them with these global leaders so that they're up to date on the latest information, and any way that we can be of an asset and a resource, we will strive to do. All of our content, I just want to emphasize, is free. We're not being paid for this. We do this out of the passion and the mission that we have to really make a global impact. And that's really, I think, what sets us apart from other organizations, because everyone in our team is passionate about making a positive global impact, and I'm happy to see us continue to do that with each and every day.
Fantastic. Well, this is really a phenomenal resource for the oncology care team, so thank you so much for talking to us about it today.
Thank you so much for the opportunity, and please continue to follow us on all of our platforms. Thank you.